All right, so reviewing our conditions in the genitourinary and gynecological systems, again, kind of make note as well, as I had said before, about the signs and symptoms and some of the differential diagnoses, and bear in mind that some of the differential diagnoses for these conditions don't necessarily have to be within the same system, and I'll maybe kind of point some of those out just to give examples as we go along. But if we look at starting with kidney stones, so kidney stones are basically when the urine becomes supersaturated and they end up basically forming solid crystals, and they could be formed in various areas. So they can be found in the ureters, the urinary bladder, or the urethra. So basically anywhere along that tract you could have the stone actually form. Now, if you look in your textbook, they do talk about different types of stones. You don't have to know all the different types of kidney stones, but I will say pay attention to the way they're all formed, so that you at least have an awareness as to how all the different individual stones are formed. So you don't have to know them verbatim, the types of stones, but at least if you know the way they're formed, you understand in the pathology as to how they come about. Many times stones pass spontaneously, so they kind of will just pass without any additional treatment needed. However, sometimes there are instances where, the individual may require hospitalization. So a lot of this just depends upon the signs and symptoms that the individual is presenting with as to how severe the issue is and whether or not they'll need referral. Now, I had mentioned at the start of this talk about the awareness of the differential diagnoses for these conditions. So for instance, one of them with kidney stones is an abdominal aortic aneurysm. So an aneurysm is when you have a weakening in the blood vessel. So that's not a genitourinary condition, but it's something that needs to be kept in mind for when you're looking at kidney stones, because that's a pretty serious condition. An individual with kidney stones may not even have to go to the hospital. Somebody with an abdominal aortic aneurysm, that's an urgent thing that would need to be addressed right away. So, and again, that's not the only one, but I'm just including that as an example so you see moving forward when looking at some of these other conditions. All right, sports hematuria. So hematuria is blood in the urine. Sports hematuria is a benign condition, and usually what happens is this is associated with exercise or activity. So what basically happens is, because of some of the trauma that would happen indirectly in sports, there may be a small amount of blood cells present in the urine. So remember what urine consists of, and when you go to test for urine content with like a urine dipstick test, only those things should be in there. So urine is primarily, water, salt, maybe some mucus. There shouldn't be any whole blood cells or whole proteins present in the urine. And what this hematuria basically comes from is typically from, some rather intense exercise involved in certain sports. Most of the time, these individuals are asymptomatic, so they tend to not have any symptoms. So this is a lot of times something that maybe comes about as a result of maybe testing for something else. It gets kind of discovered. It can, however, come up as a coexisting pathology. So you have to keep in mind, what you're looking for if someone does get urine testing done. What is it based on their symptoms that you're actually looking for? Because maybe finding the trace amount of blood in their urine may not necessarily be indicative of the problem you're looking at. It could be almost like an incidental finding when you're looking at this. So you have to bear that in mind. Obviously, with females, you have to bear in mind that what may come off as hematuria may actually be menstrual blood. So you have to bear that in mind when you're also, if you're ever going to test the urine in a female athlete, that could be something that comes about as well. There's various levels that could in causes of this, so keep that in mind when you're looking at your readings for this as well. All right, urinary tract infections. So these can involve, again, any area of the urinary tract. So again, urethra, ureters. It could even involve the kidneys as well. So anyone can develop a UTI. Young women do tend to be, sexually active young women do tend to be the highest risk category. And again, some of that just has to do with the anatomy. We talked a little bit about the urinary tract in a male versus a female and what makes females just more susceptible to infections. So it's the most common bacterial infection seen in most care settings. And again, depending on where the infection kind of settles, it could either be in the upper or lower urinary tract. Most commonly what you'd see is the urinary bladder being involved. Depending on the type of bacteria and where it kind of settles will usually kind of dictate what type of treatment will take place. Urethritis and cystitis. So these are things that can happen as a result of infection or by other types of irritation. So urethritis is inflammation of the urethra. Cystitis is an inflammation of the urinary bladder and ureters. So both of these conditions are subcategories of urinary tract infections. So common infectious causes of what we consider UTIs usually involve these areas of the genitourinary tract. And again, just depending upon where the infection takes place and signs and symptoms wise, will differentiate whether you have urethritis versus cystitis. And if you just even think about where those, anatomically kind of where those areas are, you can kind of get where your signs and symptoms will start to develop and what kind of signs and symptoms the individuals will have. And again, they can have non-infectious causes as well. So the urethritis and cystitis don't necessarily have to be caused by a bacterial infection. Commonly they are, but bear in mind that they do not necessarily have to be caused by this. Also, other types of inflammatory and infectious conditions are kind of included in the discussion here with this. So there's other areas. There's, for instance, in males, there's epididymitis, there's prostatitis, so inflammation of the epididymis, inflammation of the prostate, which again don't have to have infectious causes. So they're kind of also included in kind of, again, differential diagnosis or when you're trying to decide where these conditions take place. So again, be mindful of those other conditions that you read about when you're talking about trying to differentiate between these different conditions that we're looking at. Okay, sexually transmitted infections. So we had mentioned a lot of very similar signs and symptoms as it relates to the urinary tract infections. They tend to affect males and females differently. So you can kind of see some of those differences between the two as you're kind of going throughout the reading. Males do tend to come forth more regularly with signs and symptoms, whereas women do not. Mainly because of their, anatomy may preclude some obvious symptoms. So women tend to sometimes try to self-treat if they have a urinary tract infection, whereas males tend to not do that. So again, we're going to talk about some of the different types of sexually transmitted infections. Most of them have very similar signs and symptoms. So dysuria, urethral discharge are all common things you will see with a lot of these, but they have different causes, and some of them could be a little bit more severe than others. So we're going to talk about that on the next slide and actually kind of separate some of the different sexually transmitted infections that are present here. Okay, so some of the common sexually transmitted infections. So genital warts or human papillomavirus, which is caused by a viral infection. Syphilis, gonorrhea, and chlamydia, which are all bacterial infections. HIV or human immunodeficiency virus, and herpes 2, which is another, which are also viral infections. So start off again being able to differentiate between what's a viral, what's a bacterial infection. Herpes 2 which is different from herpes 1. So herpes 1 is herpes elsewhere on the body. Herpes 2 differentiates with the genital herpes. So when you're going through a lot of these, kind of note some of the differences. Like for instance, syphilis, which is a bacterial infection, has various stages that a person will go through. And, you know, syphilis, for instance, can have actually more systemic effects related to it versus the other bacterial infections. So if you look at syphilis and you look at the late stages, there's actually a lot of things that affect other body systems. So there's actually implications to the neurological system. There's potential cardiovascular issues that could kind of come about as well as a result of late untreated syphilis. So, you know, kind of note that as you're going through. So that's a lot different than what you see with a lot of your other sexually transmitted infections. Okay, so, you know, chlamydia and gonorrhea, for instance, which are also bacterial conditions, have a lot more local symptoms as opposed to syphilis. Obviously, when you look at your viral conditions, HIV has a pretty extensive treatment and everything that is required, because HIV can eventually progress into acquired immunodeficiency syndrome or AIDS. So that has some long-term effects. So when you're looking at all of these in your textbook, make sure to, you know, kind of be able to differentiate, you know, which ones require a much more elaborate treatment and how their symptoms kind of progress. So the symptoms obviously can be a little bit more systemic over time with certain conditions, whereas others it's a little bit more locally contained to the urogenital region. So this is just a picture, and this is actually, and again, you can still have, I had mentioned how syphilis, if not treated long-term, will cause a lot of complications. There can be other complications to the other two, but again, they tend to be a little bit more local to the genital and reproductive areas. This is a picture illustrating salpingitis, which is an inflamed or infected fallopian tube. So this can occur because of other causes, but it's specifically here, it's relating back to a female with possibly unresolved gonorrhea that could possibly have this. So again, be aware of some of the other complications of some of those sexually transmitted infections. Okay, testicular torsion. So when a male, this could be something that could happen as a result of just even direct trauma to the genital region in a male. This is one of the things you have to be on the lookout for, because this could obviously cause some long-term complications. So, many times, aside from it being physically very uncomfortable to have when it happens, most of the time the trauma could be benign, but you have to keep a lookout for things that could possibly cause complications, because obviously it could really impact the male later on down the road. So testicular torsion happens when the testicle is able to twist, and again, many times this will happen as a result of trauma, and this could obviously cause some venous occlusion and arterial ischemia, and there's a picture of this on the next slide, and it's also the same one that's in your textbook that you can actually see what this actually looks like when it happens. It's showing there kind of the highest incident, and many times, particularly in younger individuals, some males can actually be more prone to this because of some different types of anatomical differences that may have happened. There's something called the bell clapper deformity, which your textbook talks about, that can possibly make someone a little bit more predisposed to something like this. It says here, and this is a common thing to look at as well, it does predominantly affect the left testicle because it does sit slightly lower than the right. So here's an illustration kind of showing you, so you can see some of the anatomical structures that we had discussed, and then you could kind of see how in the picture where the torsion is taking place, kind of what the deformity looks like and what happens to the vascular structures and the vas deferens as it would basically get entangled in there. So it's important to note the red flags that are present in the textbook, because that could be a clue that there's something, going beyond a little bit more than just the actual trauma that took place. And kind of a good rule of thumb is that if an athlete were to have significant pain beyond about 10 minutes, that it starts to clue you in that there could be potentially more trauma to the region than initially thought. Okay, a hydrocele is a fluid collection within the tunica vaginalis of the scrotum or along the spermatic cord. So it's basically a fluid pocket that forms in the scrotum of a male. Many times they're developmental, so if there's an anatomical anomaly present, for instance, the patent process vaginalis could cause this. So some people have these clinically, and they could be asymptomatic. So it could be something that could be asymptomatic, or it could also cause some discomfort in the scrotum or some painful scrotal swelling. So the picture on the next slide will kind of illustrate what this looks like. Part of what you're looking to do here, if someone does notice it and would bring it forth to a medical professional's attention, it would need the many times a diagnosis has to be confirmed, only because there's other very similar, there's conditions that are a little bit more serious or require more attention that present very similar to this. Okay, so your book talks about things like epididymitis, testicular tumors, all kind of present very similar. So until it's kind of discovered what that it's confirmed that it is a hydrocele, you have to bear that in mind. Even if it's asymptomatic, and if it's something that's discovered, you would need to make sure. Typically, it doesn't preclude any participation, or it only usually has to be surgically repaired if it becomes symptomatic in an individual. So take a look at those other conditions that can present similarly to this, and you could see where this would be something that would have to be ruled out diagnostically. And again, here's just a kind of a picture showing you how this would form. Again, a lot of times this can be asymptomatic in an individual. It's not unusual to have that happen. Again, it's for unknown reasons this could form. We had talked about some of the differences as far as the anatomy is concerned, but it can also just even result as an imbalance of fluid production and absorption in the scrotum. So again, it could have some unknown causes as far as why this would develop. So we talked about a hydrocele. So a hydrocele is a abnormal fluid development in the scrotum. A varicocele is when you get dilation of the venous plexus with the spermatic vein in the scrotum. So it's basically like varicose veins in the scrotum. Again, the etiology is unclear. It's not quite sure why they develop. However, they do find that many infertile men have this. So obviously there can potentially be a connection between this and infertility. So it's something that, if it could possibly be corrected, it may be something that someone may want to consider if they find it, at a certain point in time in life. Again, much like the hydrocele, many times is asymptomatic. Some individuals may report like a heaviness or a pain in the scrotum from that, and the kind of the classic, clinical sign is what they describe as when palpated is a bag of worms. So you can actually feel the enlarged veins in the individual that has the varicocele. So here's just a picture kind of illustrating this, so you can see where that bag of worms description would come into play. Again, there's no, for someone who's asymptomatic, there's no medical treatment per se. If someone does get symptomatic, there are procedures that can be done, and then there would have to be a gradual return to play based on this. Another way to kind of determine that a person may have this is through the use of a Valsalva maneuver, which we're going to talk about on the next slide. So here's the Valsalva maneuver. The Valsalva maneuver is useful actually in diagnosing a couple different things, but this can help with the diagnosis of a varicocele. So basically what the Valsalva maneuver is, what someone does is takes in a deep breath and then exhales against the closed epiglottis or bearing down. You can see that the nose is pinched to prevent the air from going out the nose. So, or one of the common ways to kind of cue this in an individual is to tell them, pretend you're trying to make a bowel movement for the Valsalva maneuver. So someone that has a varicocele would experience a fair amount of discomfort with this test. Okay, testicular cancer, and again, many times when you're talking some of the different deformities in the scrotum, this obviously becomes part of the differential diagnosis. So it's an abnormal growth of cells in the testicles. Again, this is, low as far as the occurrence, and one of the good things about it is that there's a high cure rate if diagnosed early. So if diagnosed early, this is something that can basically be cured with this type of cancer. So the survival rate is actually pretty high, and many times it basically just involves the early detection, finding the tumor, and then basically the testicle at that point would then just be removed, and then pretty much as long as the cancer hasn't spread, it's basically cured at that point. It typically affects men between the ages of 18 and 44, so it does relatively impact younger males. So that's why you'd have to consider when talking about some of these different deformities that you would have to, again, basically kind of rule this out, even in your younger population. So note the red flags for this, because there are some specific things. The one thing about this is the swelling that occurs with this, or the tumor formation, tends to actually be painless sometimes. So anytime there's any type of painless swelling, which again could also be a hydrocele, but would be important to rule out cancer. So the appropriate referral so that diagnostic testing can be done to make sure that it is not cancer. So your textbook just talks about the procedure for doing a testicular self-examination. So this is something that they recommend, males of a certain age to at least perform maybe even once a month, and what they do is prefer to have them do it after a shower to just allow the scrotal skin to relax so that they can actually palpate. And basically what the male would be looking for would be any type of nodules or lumps in the testes. Okay, prostate cancer. So it's an abnormal growth of cells in the prostate gland. This is a much more common cause of cancer deaths in men. Again, you have some demographics there as far as like who it impacts the most. So it's a relatively high thing, as particularly as one ages. So unlike testicular cancer, this is not something you typically have to worry about in a younger male. Typically, you're looking at 40 and older for this type of cancer, and they recommend that males over 40 get regular exams to make sure that they are not developing prostate cancer. Again, if caught early, it is relatively easy to treat, and you'll read about some of that and what they use to treat it in your textbook when you're noting the treatments for this. But note the diagnostic testing. Again, there's a lot of other prostate issues that we don't talk about directly, but again are included in the differential diagnosis. So for instance, someone could just have benign prostatic hypertrophy, which is basically just the prostate gland in men as they age does get larger. So that could cause some of the early signs and symptoms, but again, it would have to be ruled out. There's chronic and acute prostatitis, which is inflammation of the prostate gland, which can have both infectious and non-infectious causes. So those are just some of the things that can also be related to prostate cancer in the male. Okay, so looking at some of the pathological conditions in the gynecological system, so looking at some issues that really only affects females. So vaginitis is just an inflammation, usually derived from infection of the vagina. So there are other causes as well. There are fungal causes which can happen as well, and many times that can actually be caused by an estrogen deficiency. So this could be a case where you'd want to discuss the reproductive cycle with the female to make sure that her cycles have been normal, to make sure that there's not any other type of hormonal condition. So there's different types of causes of this that your book highlights. There's the bacterial vaginosis. There's a candidiasis, which is not a sexually transmitted infection, but it can occur as well as more fungal based. So look at the different causes of this condition when you're looking at this, and some of the different ways that they are treated. Pelvic inflammatory disease is a bacterial infection in the upper genital tract that originates in and ascends from the lower. So it includes various different types of disorders and can stem from a lot of different things. So endometriitis, inflammation of the endometrium, salpingitis, which we already showed, and a lot of sexually transmitted infections can cause this to happen as well. And your textbook, and we're going to show some pictures of some of the complications related to pelvic inflammatory disease. Prompt diagnosis and treatment of this is really important. There's a lot of ramifications to an individual getting this and possibly getting treated late. So this could cause infertility, it could increase the risk of an ectopic pregnancy, and it could even just cause some chronic pain problems in females if not treated in a prompt manner. So here's just a picture, and this is also in your textbook, showing you some of the complications as it relates to pelvic inflammatory disease. So it's kind of showing the inflamed fallopian tube and the inflamed ovary. So again, this would be something that would happen as a result of another type of infection. So, and again, just where the inflammatory disorder would kind of settle in would be the area where you would have problems. All right, so now we're going to look at some issues as they relate to the female menstrual cycle. So dysmenorrhea is a presentation of severe cramps and pain associated with menstruation, and this gets categorized as primary or secondary based upon the causes. So primary dysmenorrhea is not associated with a growth pathology. So primary basically means is there's not a specific cause to it. It's just basically the process that individual person is going through. Their symptoms tend to just be a little bit more severe, whereas with secondary dysmenorrhea is caused by some type of actual pathological process. So in other words, there's something else going on that causes the dysmenorrhea. So this can include something like endometriosis, it could include pelvic inflammatory disease, tumors, things of that nature. So that you'd have to basically differentiate between the first two, whether or not it's getting caused. So there's something to bear in mind. So if a female has, persistent dysmenorrhea with her menstrual cycles, you may want to determine whether or not there's some other type of issue going on, and many times there'll be some other signs and symptoms associated with those disorders. Okay, so amenorrhea, which gets classified as either primary or secondary. So primary amenorrhea is defined as the absence of menarche by age 16. So basically, by age 16, if a female has not had her first menstrual cycle, that's considered primary amenorrhea. Secondary amenorrhea is once a female has already had her first menstrual cycle or has begun menstruating. Basically, it means that future cycles are either prolonged or she misses cycles. So that would be secondary amenorrhea. So again, if a female has already had her first menstrual cycle, but then down the road has abnormalities that would be considered secondary amenorrhea. So basically, that's absence of menses, depending upon how often it occurs. It could get classified as some other versions as well. And there's secondary conditions that will result. So obviously, we had discussed in length in class the reproductive cycle. And again, it's very important for that to be functioning properly in a female, because there's a lot of other health conditions that could then come about. That's why it's so important to be aware as to when all those hormones are supposed to be active, because again, if for some reason they're not functioning right, there's a lot of secondary things that can possibly occur as a result of that. So again, go back and review and make sure you have an understanding. They do talk about it again, what goes on as far as the hormone secretion is concerned. But again, there's other conditions that can occur as a result of this. A lot of discussion will go towards the female athlete triad. So what the female athlete triad is the occurrence of amenorrhea, an eating disorder, and osteoporosis. And those three things are very commonly tied to one another. So athletes who do have an eating disorder, many times that gets put into the female athlete triad and some of the complications that could happen with that. Polycystic ovarian disease, so basically the formation of these cysts within the ovaries as a result of the anovulation. So obviously, if a female is not going through her menstrual cycle, she's not ovulating, and that could cause problems there. Many times the result of this is just many times the high intensity training that athletes undertake. So it doesn't necessarily have to be happening and cause necessarily other issues or be the result of other things like an eating disorder. So you bear that in mind. It could be the result of just high intensity training. It would still have to be treated as such, but it doesn't. That could be the primary cause a lot of times. It's just that that intense training. But you look at one of the things being like bone density being a concern. As with something like this, obviously estrogen levels will not be where they would need to be, and that would then affect bone density problems. So that would have to be kept in mind. That's one of the reasons why, as we talked about, in a female who potentially you look at as maybe having a stress fracture, that possibly being associated with this. So it would be important then to question about menstrual cycles and making sure. And again, like I said, there's other classifications of this. So for instance, there's oligomenorrhea, which if you look at the definitions into how they occur, they talk in the first paragraph in the chapter about how it can be a little confusing, but they delineate what it means by the different lengths of the cycle. So for instance, oligomenorrhea is used to describe menstrual cycles that are greater than, they say, 36 days. So that's something that kind of changes that as well. But basically, any type of abnormal lengths of cycles or cycles that just happen infrequently would possibly cause issues. So make sure to look at some of the physiology behind that. Okay, ovarian and cervical cancer. So ovarian cancer is a malignant growth originating from the ovary. This is the leading cause of death from a gynecological malignancy. So again, it's important to kind of note where this is coming from. Cervical cancer would just be the malignancy originating in the cervix, and it also has significant morbidity and mortality as well. So these are both some of the more common cancers in females. They do have a very high cure rate if detected early. So again, make note of the differential diagnoses and what you'd have to be looking at with the signs and symptoms associated with these. Breast cancer is a neoplasm arising from the breast tissue in females. There's other areas where it could originate in. Many of the significant portion originates within the lobules of the breast. The cells can escape the breast and metastasize, and that's one of the big concerns with this. So metastasis is just when the cancer spreads to other parts of the bodies. With the exception of skin cancer, this is probably the most commonly diagnosed cancer among women. So again, important for regular checks, any type of abnormal lumps or masses in the breast that they get looked at. There's also many cause for benign lumps and lesions within the breast as well. It's important to note that there's fibrous cysts that could form. It's also important to note that anytime a female were to find a lump or a mass, that she's also questioned about where she's at in her reproductive cycle, because sometimes that could impact this as well. Many times the initial tumor is painless, so a lot of times if there is a lump that is painless, or any type of like skin puckering, those would be things that would probably want to be looked at. Many times they can be just fibrocystic changes, and again, sometimes even breast tenderness could occur just before menstruation. So it would be important to kind of ask, where the female is at within her cycle, because that could be causing some of her signs and symptoms as well. So this is just, again, kind of showing the anatomy and showing where some of the issues could possibly relate. So you could refer to these in your textbook as well. It's just also showing the various structures within the female breast tissue. And here's showing the lymphatic system. So again, the lymphatics are kind of our body's filtration system, if you will. And again, this is also commonly where the cancer would metastasize as well. So if the cancer gets into the lymphatic systems, it would carry it throughout the body, and furthering the metastasis progression. And this is just kind of showing the procedure for a self-exam. So very similar to the male having a self-exam for testicular cancer, a female should regularly do breast self-examination. And it just kind of shows the palpation pattern to make sure that there's a thorough, and again, any abnormalities noted, it would be important to bring forward to a medical professional just to check to make sure. An ectopic pregnancy is when the fertilized egg implants outside of the endometrial lining. So if you remember in our discussion in class, we had talked about where basically the fertilized egg is supposed to implant. If that happens anywhere else, there's issues that could kind of come about. And this is lethal for the fetus, but it could also be for the mother as well. So the fertilized egg will not be viable when this happens, but it could also be deadly for the mother because of the massive hemorrhaging and bleeding that can occur. So appropriate diagnosis is really important. So, if you were to have a female, for instance, and this is just one example, there's other things that you need to make note of, but a female with severe abdominal pain who has maybe not had her last menstrual cycle, this could possibly be a concern for her. So you would want to make sure that the appropriate prompt referral and treatment were to take place. And then this is just kind of showing some of the different areas where the possible ectopic pregnancy can occur, and there's different types you can see. So any of those regions would be a problem. So again, the implantation of a normal pregnancy, if you see on the left-hand part of the screen, is in the uterus within the endometrial lining. If that happens anywhere else, there are severe complications that can result from that. So that's the last condition. Again, make note of the associated conditions when you're looking at this. Okay, so, and because again, that could be important for you both in just test questions and in looking at any case studies, additional case studies that we do in class.